of the cycle of seminars regarding displacement, migration, and integration of EGAP. So now I am going to give some brief instructions to simultaneous interpretation into English, and then I will speak in Spanish again. Hello, everybody. Welcome to this seminar offered by EGAP on one of the priority topics today. If you want to have access to simultaneous interpretation, please click on the interpretation button at the bottom of your screen, and you can select the English language so that you can hear the session in English. And finally, select the word mute original audio so that you can hear only the interpretation and don't hear the main audio. Thank you. How incredible it is to have coordination between academicians and foundations and organizations and institutions that are interested in having an impact on society and public policies in their countries. So, as I said before, this is the second event that is held within one of EGAP's priority topics, and the topic is displacement, migration, and integration. The title of this presentation today is COVID-19 and Maternal Mental Health of Displaced Population in Colombia. Before I introduce you to our wonderful panelists, I am going to explain what EGAP is for the people who don't know, and then we will start the discussion about this wonderful project. EGAP, according to its acronyms in Spanish, it would be Evidence in Governance and Policy. This is a research, evaluation, and teaching network consisting of researchers, members of non-academic organizations, institutions, and foundations that seek to create an impact on public policies within their countries to have an impact on the quality of life of the society in which they're operating. They also develop public policies, and we have members from all over the world. The network has two general objectives. First, promote the accumulation of knowledge in a rigorous way. This means understanding what happens in our reality, but doing it in a systematic way to make sure that the information that we're obtaining is faithful to reality and that can teach us how to change the situation and improve the issues that we are facing. And the second purpose is to innovate and promote public policies based on empirical evidence in different areas of governance and accountability. The network, EGAP, has defined a series of priority topics to focus on and to gather researchers and members of organizations and foundations that seek to create an impact in their country whose efforts and interests are related to these topics. And they gather them together, they hold discussions about these topics, and the idea is to promote a generation of new ideas that can also become part of new research agendas and that could benefit both the members at the foundations and institutions, the academicians, and also the people who develop public policies. If you wish to have more information about the network, you can click on the link that is posted in the chat, and this will take you directly to EGAP's website. So now that I told you a little bit about the network, now we are going to go into the topic for today. We are going to discuss about this project known as COVID-19, maternal mental health of internal displaced populations in Colombia. I am going to introduce you to the panelists in alphabetical order, but according to the first name. My last name is Aguilar, and I always had to be the first, and I didn't like that. So we're going to do it now with the first name. We're going to start with Andrés Moya. He's an associate professor from the Department of Economics at Universidad de los Andes in Bogotá, Colombia. His research is focused on the fields of development, behavior, and experimental economy. A great part of Andrés' efforts have been focused in the economic, psychological, and behavioral consequences of violence and forced displacement in Colombia. His work right now is actually focused on analyzing the behavioral consequences of violence in early childhood, and we will know that the interests of Andrés and the organizations that are represented by Diana and Cristina are very much associated to be able to undertake this project. Now, Cristina Gutierrez de Piñeres, she's the Executive Director of United Way Colombia, which is a foundation with a network of people and companies and public organizations and private organizations that seek to create a more inclusive society by developing and improving educational and innovative solutions that seek to improve the quality of education in Colombia. And Diana María Pineda Ruiz. She is a social investment leader, the manager of knowledge of Fundación Éxito, which is an institution, a nonprofit institution that is focused on fighting against or improving child nutrition. Diana Maria is a nutritionist dietitian with more than 14 years experience professionally in project management and mother and child nutrition and advocacy in health public policies and early childhood development. Thank you to you three for being here and for telling us about the project that you are working on together. Well, the way in which we're going to have this conversation is that I'm going to ask some questions, but if any participant wishes to ask a question to the panelists, please just write them on the chat and I will read them out so that the panelists can give us an answer. So these questions are there to focus and guide the discussion. As I said, if you have additional questions, we can ask them without a problem. And if you want us to see your faces, it would be great if you can also turn on your cameras. I know it's a bit scary, but turn on your cameras if you can. Please tell us how the Semillas project starts and what are the main purposes and objectives. Thank you, Rosario, and thank you, EGAP, for organizing this event, and Cristina and Diana, and Fundación Éxito and Fundación United Way who have been supporting our work. I want to start off by talking about mental health during COVID, but this actually started out in 2013, 2014, when we started to think about what is happening with early childhood, boys and girls between 0 to 5 years of age who are exposed to armed conflict, forced displacement, and all the trauma that this generates on them. At least in Colombia, we have seen great progress from the policies on the one side to protect the migrating populations and on the other hand to protect early childhood. But there was a concern of how can we connect these two topics, what happens with these boys and girls. Early childhood is the most important time in life. This is a moment where the brain architecture is established and the basis for emotional intelligence. And we know that during these times, this exposure to adverse events such as displacement, violence, and conflict have consequences that could be lasting forever. And they could affect the development of the children, they affect their paths of life, and there are implications throughout life in terms of physical, mental, and emotional health, and also in terms of productivity and employment. So we started to work that then, and we partner up with the University of California, San Francisco, between psychologists and economists to develop this program that is called Semilleros. But we quickly found out that our capacity of advocacy and our capacity of operation and our capacity of getting to the territories was limited. And soon after conducting a pilot test in 2015, we approached United Way. Back then, it was the Genesis Foundation for Early Childhood in Colombia, and they were working in the territories mostly affected by conflict in Colombia. And we also approached Fundación Éxito, who have had experience in working with early childhood as well, to start making this project a reality, and specifically to be able to get to one of the territories that have been affected mostly by conflict in Colombia, which is Tumaco. Tumaco is a province to the southwestern region in Colombia, border with Ecuador, and United Ways had been working there for a long time in the childhood development centers, and in our joint efforts we were able to get to the territories, implement the program, and also assess the program and assess the impact. I'm going to stop for now so that I don't take up more of your time. Thank you very much, Andres, for that introduction. It's very interesting. So now that we understand how everything started, how the project started, can somebody tell us about what are the circumstances that took place for this collaboration between Universidad de los Andes, United Way, Colombia, and Fundación Éxito? You told us a bit about that, Andres, but I would like to hear from United Way and Fundación Éxito. What are the benefits and challenges that you have experienced based on this collaboration? Well, special greetings to everybody joining us today, and thank you for giving us this opportunity so that we can share our experience firsthand. It was truly a very challenging experience, merging the both worlds, two worlds of the academia and the foundations, especially for us who had to be present in the territories. It was an interesting experience. I think that in the both parts, and Diana from Fundación Éxito as well. But since we were in the operation, it was harder for us. We had to mediate between the rigorousness of the economists and the evaluation or the assessment, which of course is necessary, and the challenges of intervening in a community like Tumaco, which of course you have an action plan, but everything could happen in the territory. It's a community that faces great conflict. So in the daily activities that we executed, there were things that were out of our hands, and all of this ended up affecting the assessment as well. So we needed to have many contention plans. I think that the most valuable aspect of these partnerships is to be able to build trustworthy relationships where each party is contributing from what they know what to do, and we're allowing the others to do their work as well. So I think that here we were able to have these conditions. The other two aspects that have been important for us at the foundation were first to validate a model, as Andres said, comes from the United States, and it was validated initially with some specialists with the level of education and development that was very developed and advanced. So what does it imply to bring this intervention that is so sophisticated to a territory where practically what we found were just social workers with a level of education and training that was limited? To be able to work together with the partners in that validation of this intervention has been one of the greatest lessons learned and challenges as well. The other thing that I would mention is also related to the importance of generating evidence of the best practices that we have in the territory. We don't always have the luxury to have necessary resources to finance an assessment, and even less an impact assessment. So this for us has been a wonderful experience in the sense that we have invested all the resources, economic resources and technical resources and human resources to the implementation, but also with the benefit and the joy of having had support from this assessment and to be able to say what truly works and what could be improved. These to me have been the lessons learned, the most important ones for us. Well, Rosario, thank you very much. I agree with everything that Cristina just said, and I think that we do see a light of hope for the children in Colombia. given everything that they represent and the challenges that we saw in the territory. We had to outweigh these different challenges and to work with partners in the territory like the Genesis Foundation under the leadership of Cristina. I think that made a difference because these are very diverse territories, and to get there and to combine the academia and the statisticians to every committee that we had, this represented challenges. When Andrés was talking about the conditions that the researchers had to face out there in the field, which was the reality of the country, because sometimes it was easy things such as the state procurement to be starting on time, but this also affects the children. But in addition to this would mean that the assessment would going to vary in its statistical power. And what we were proposing to be truly generate robust evidence that could have an impact on public policy. This was actually the great motivation that led us all to work on this. And Fundación Éxito, this was very special for us because we joined this project immediately. We talked to Genesis because we were working on something that was nutrition in its soul. We are working for the childhood nutrition in Colombia, but we also wanted to close gaps from the emotional perspective in children, given some critical aspects such as care and raising these children, because there's no childhood nutrition in that sense either. So I think that the lessons learned have been gigantic. The challenges still remain. I think that the biggest challenges that we have in the program is that we can truly make sure that this is not just accessible to a few children, but that it becomes universal and that we can escalate it based on public policy, but to have scientific evidence validated by the academia with researchers and with scientific evidence so that we can take this message in a more robust way. I want to add something as well from our perspective, and I want to highlight a couple of things as well. First, this wouldn't have been possible without this partnership that we were able to build. And I think that, as Cristina mentioned, from our logic and from our way of working, from the way in which each organization does things, and us as academicians who are sometimes obstinated on some elements that we know are very important, because we want to establish the best practices that would allow us to conduct quality assessments. But as Diana and Cristina mentioned, sometimes we would get to the committees, we would go to the territory, and we realized that one thing is what I have in my head, and another thing is what is happening in the territory, and especially in this territory. In Tumaco, just as an example, there are invisible borders. What this means is that you cannot walk from one neighborhood to the other because each neighborhood is controlled by a different group. And this is a territorial mechanism of control. And if you're going to walk from one side to the other, they just shoot you, to say the least. So how can you start incorporating this within your design for the sampling? How do you incorporate this in the design about how you're going to implement the program? And from the academic part, you say these are decisions that you shouldn't have made. But a different thing is when you're out there in the territory. And especially having two partners with experience and implementation in the territory, we understood how to navigate these situations, how we were able to understand these restrictions, and how we can map this out as part of the assessment so that it's solid and it can talk about the potential of the program so that we can escalate it. At the same time, we were able to understand what are the roles and the objectives of every institution and why for United Way and why for Éxito this evidence is so important and why it is also for us. I also want to highlight that hopefully this is not the end of Semillas, this assessment that we conducted, nor the end of this partnership, but that we can start escalating and start understanding how this could work in a greater structure. Very good. Thank you very much. I think that this conversation is actually showing us that there could be conflict, so to say, but maybe in the way that we work there could be some sort of clash. But if you are able to improve all the different areas and all the parties together, from how we see it from the academia and how they think about it from the implementation and the benefits that we can obtain. I think that this is great that you can develop this project and you can continue this collaboration, because it shows how well we can work together and the good results that we can develop. So let's continue. Now we are going to focus on the study that was published in the Lancet magazine. I would like to know about how this idea of developing this study came up that talks about the mental health of mothers and that are displaced within Colombia, but during the pandemic. Why did you choose this topic? And I think that when things happen that are outside of our control and we take advantage of them, this is when good things come up. Yes, I agree, Rosario. Thank you. Well, this was an article that was published unexpectedly. If we look to the past, it was a bit obvious that one of the dimensions that we wanted to study as a consequence of the pandemic was mental health, the maternal mental health, what is happening within the households, right? In Colombia, we were locked up on March 23rd, 2020, and we were in a lockdown, a strict lockdown for 5 to 7 months. And as part of the impact assessment at Semillas de Apego, we were close to collecting the final data, just the missing ones. After 3 years of working on the program, the implementation and the training and the community agents and all the data collection process, we were just missing one final data segment that we had to collect. And that was prepared for April and July 2020. We were just offering the training to the teams, and it was the time in which we could have said we made it, but at the time the pandemic came in and we had to go into lockdown. So just quickly, we held a committee and we decided to launch a quick telephone survey. We could not go to the territory, of course, because of the isolation measures. So we conducted a brief telephone survey where we selected some of the measurements that we had from the large survey. And I think that, to me, naively thinking that we could obtain some information without being affected by the effect of COVID. And this would allow us to protect the impact assessment. I back then thought that maybe in 4 or 5 weeks, we were still going to see the differences between the people who participated in the program and those who didn't. And we could have had the full sample for this impact assessment. But quickly, and after looking at the survey, we realized that it was everything different. 4 or 5 weeks after the pandemic, there had already been an increase of food insecurity to 73%. 73% of the families were already reporting that they had to cut down their food servings every day to be able to go through the pandemic, and 75% was already reporting that they had lost their main source of income. Tumaco is a population with a very high level of informality. Within our sample, 90% of the people depending on informal income. So imagine this, they close down the city and what happens, right? So 4 or 5 weeks into this, we started to see these great levels of food insecurity and economic difficulties, and we started to see an increase, a substantial and systematic increase in the levels of anxiety, depression, and stress in the parent relationships. So once again, the Semilleros de Apego program is focused on promoting the mental health of the mothers and caretakers as an objective that is important, but also as a vehicle to protect boys and girls. And what we see that there's a huge clash that generates concerns, loss of income, stress in mothers, huge stress on them, and as a consequence, also stress in the families. So we didn't just realize that we had been naive, but we also noticed that there had been an important story to tell, because as part of the many dynamics that were established and the studies that were established during the pandemic, I think that mental health was something that did not arise immediately, and especially the mental health of a population that is so vulnerable, such as the population that is exposed to conflict and displacement. So quickly we started to analyze the data, and I think that 15, 20 days later, we already had the full landscape, and this is where this Lancet study came up. Then we conducted a follow-up. We followed up on this 10 months later, and then we were thinking that maybe after 10 months, people should have recovered their emotional stability. But on the contrary, what we saw is that by November 2020, the levels of anxiety, depression, and parental stress were very much above the baseline and the persistent levels of what we saw in April. And the message here is that these populations are populations that face a huge deal of risk. And when the pandemic comes in, these risks are magnified, and these are now the people who were suffering the consequences of the pandemic the most. And we wanted to create attention to this so that we could promote some policy focuses and programs. And now I want to give the floor to Cristina and Diana so that they can also tell us about what they did in their respective organizations. Yes, thank you, Andres. Actually, Cristina and Diana, can you please tell us about how your foundations reacted to COVID-19 and specifically related to the populations that you were serving already, and how you used the information that you obtained from this program, from this project in Tumaco, to inform the strategies that you used to address these populations? Well, what Andres just told us, these were quite challenging times with the best intention of continuing our interventions, but basically with our hands tied in a way. So from United Way, we quickly launched two solutions or two new programs to be able to address the psychosocial effect that the pandemic was causing on the educational agents and on the teachers, and of course in children and the families as well. But I'm going to tell you about two cases. One of them would be the socio-emotional care path, and this is basically aligned to the curriculum of Semillas de Apego in the focus of trauma and the effect of violence, or the crisis in the emotional state of the families and of the educational agents. And this route designed a 100% virtual intervention, which was open to teachers first. We had more than 1,000 teachers participating directly. And then the interesting thing is that this route and this solution gained traction amongst the companies that are supporting us at United Way, and it became one of the most important programs during the pandemic. This is something that came up in the midst of a crisis. The second thing as well is that we created a strategy that was an assistant help desk. In the United States and in other countries, this is more often seen, but this is an intervention that was leveraging on this remote intervention through telephone calls, or when it was possible for the teachers to have access to Zoom or to Teams or via chat. And it was aimed mainly in providing support in the psychosocial aspect, because teachers started to suffer like any human being with a double challenge of not knowing how to teach and accompany these children, especially those in early childhood, with virtuality. So there was truly a crisis and a lack of tools for them. And the second line of assistance that we worked on was mainly the pedagogical line, which is basically, what are we going to do now with these children who are used to playing in a physical space and interacting in person, but now what are we going to do? So these two initiatives allowed us to Los Andes was actually responsible for seeing what they were going to do from the assessment, and we didn't want to stop our interventions either. Well, I think that one of the results of Semillas is that we still hadn't had the opportunity of specifying. Maybe Andres will specify it better, but this is the fact that as part of the results that we obtained, the population with higher conditions of vulnerability was precisely the population that didn't show any progress. And this led us to an important conclusion, which is how these most vulnerable populations can allow us to mitigate some conditions of poverty and food security to be able to go into these emotional conditions that are so important. So when the pandemic arrived and we were seeing that we were in a Colombia that was very complicated, especially in the most diverse territories with all the confinement and the lockdown. We had never faced this situation, and the foundation deployed all the resources necessary, and we provided food packages as well. In 2020, we made an investment above 20 million pesos, but we were able to provide service to children 2.5 times the higher in the amount of children that we addressed. Back then, we also established an extraordinary partnership with the Semillas team and with Cristina at United Way, where we were able to bring food packages to the population that was part of the program. And also through the institution, we were able to reach other children so that we could give them this food. We also worked strongly on the promotion of early breastfeeding, but we wanted also to strengthen the emotional connection so that we could not just from the nutritional aspect or the contribution of breastfeeding, but also to be able to provide support to these families. And from public policy advocacy, we worked hand in hand with the academia, with the Universidad de los Andes and researchers, where we were able to work with recent researchers researches that were published globally and that we could bring them here to Colombia. And we even accompanied a research for different territories in Colombia that would allow us to see how the maternal mortality was going to behave because of all the effects, and to be perspective in our solution. If it hadn't happened yet, what are we going to do so that the risk can be mitigated? And this is how we have been supporting in the pandemic in everything that took place between 2020 and 2021. But I think that we continue doing it because in 2020, we were able to work on the contention that Cristina also mentioned a moment ago. In 2021, we still saw this contention, but in 2022, I think that now we're facing great challenges still with a population in displacement that increased in 2021. In 2021, we had 3 times more than 2020. Every day, we had 200 displaced persons in Colombia. 12,000 children were displaced. And in 2022, when we talk about nutrition, we were ranked top 20 globally, reported by the FAO as a country that is in the risk of worsening its food insecurity. But when you look at this information and why are we in that risk map, one of the aspects that they consider to rate Colombia was armed conflict and displacement, and what we have learned from this assessment. So I think that this is the moment to take it into account. Yes, thank you very much. We can see how the pandemic has affected all societies, but also we have many challenges yet to face, not just because of the pandemic, but also the different conflicts in Latin America. Well, it's not just Latin America, but the effects that are so negative, and it's not just because of displacement and conflict as such in the society. So I think that you talked about future situations, but I want to talk about this at the end. But for the rest of the participants, if you want to ask questions or if you have any comments, please write them in the chat and we can include them without a problem. Can you tell us about, Andres, what did you learn from working with the organizations and the foundations? And Cristina and Diana, what did you learn with working with academicians? You have mentioned it a bit at the beginning, but can you please delve into the topic a bit more and give us examples? Because you mentioned that you had modified things, but now can you give us examples of what changes you had to make out there in the field, or how did you rethink about the implementation of your strategies? And Andres, how did you say, or how did you solve problems that you didn't think that could take place when you realized how the implementation worked, or how the implementation of the study worked in real life? Thank you, Rosario. Well, the first thing that I would say, and I'm still learning actually, is being flexible. And with my head of the economist, academician, and with a PhD, we are not sufficiently flexible. And these have been an efforts of having clear ideas in our heads, and with a design that sounds very well in our head. We have calculations and we describe our plan, but a different thing is to get there to the territory. And also to understand what are the roles and the objectives and the interests and the contributions that we make. With these researches and with these partnerships with foundations such as United Way and Éxito, where it's not just one article that we write and that we publish, and it's important, but it's also everything that remains, and everything that remains in terms of the human capacity of a team that was trained in Tumaco and that has grown there. 6 women who didn't have much education and training. Cristina mentioned it, and we trained them and we supervised them and we have accompanied them, and that they weren't just the focal point of implementation of Semillas, but that afterwards they also contributed to United Way in their strategies during the pandemic. And this is a team that has worked, and there's a local installed capacity, right? The second thing is how we can learn, as Cristina and Diana mentioned, some of the most important lessons of what we started to see in our research. It's not just in an article, but there are also implications of, we have been talking about the importance of this connection, but to build this connection, we have been talking about the need of reducing the levels of stress and promoting maternal mental health. The pandemic created a challenge, and how we can start building upon this, and how these efforts can last even longer than our academic efforts. Diana also mentioned this. We have been talking about the importance of mental health, but we know that if there's food insecurity, it's very, very difficult for the families to have the space to work on their own emotional state if there's hunger, if they're suffering hunger, right? So I think that one of the things that we learned was the impact that we were creating that goes beyond the article that we write, and that there are many of these lessons that we see within the community, in the organizations, and that they also help us understand what we can do and for what are we doing this for. This is maybe one of the opinions that I have about this. Okay, well, Rosario, I think that I would mention 3 main aspects that we have been talking about in this session. First, from United Way, we are talking about an educational vision throughout the early childhood all the way to secondary school. Generating evidence and serious assessments, I think that it becomes something that is very important as part of what we do, especially when we're talking about innovative processes that have to go beyond the evidence, right? That's the first thing. And then we have strengthened many aspects within the foundation related to monitoring and assessment. The second thing is that we all have very good capacities of how to manage organizational tensions and how to strengthen those partnerships with organizations that aren't necessarily of the same dynamic than ours. I believe that there is a valuable path there. And the third thing that I would mention is that this led to a specific thing today, which is the importance of continuing to strengthen our relationship with the academia. We have a commission of wise men, this is how we call it, which consists of 5 foundations or 5 universities in the different territories that we work in, and they are accompanying us closely in assessment processes in the interventions that we have. So to involve the academia in what we do is fundamental, and to have had this collaborative work and introducing it formally within the organization, I think that this has been a great challenge. With Los Andes, we have a relationship of many open lines. This is not the only one, and the other lines of work also strengthen advocacy, partnership, and they strengthen the work of any foundation like ours. Well, I think that we reconfirmed huge lessons learned, and I agree with what Cristina said. I think that the best way of creating advocacy in public policy is creating scientific evidence with all the quality and the trajectory that is necessary. So I think that this is a key aspect. From the operation and administrative aspect, I agree with Andrés. I think that this two-way flexibility is extremely important, and it is necessary because it strengthens a partnership with what Cristina mentioned, because we are different entities with different focuses of points of focus, and the expected results and the trajectory and the experience of a country tells us that we need to be flexible and we need to adapt ourselves to the realities of that territory so that we can start creating change. And from the intervention and the focus of the foundation, I think that we reconfirm the need of continuing to work on interventions that involve maternal health, both physical and mental health, because we're institutions and professionals, and we agree on working for early childhood. As Cristina said, in some cases we cover all the way to secondary school because we're thinking about the development of our country and different societies. But everything has to start with the beginning of life. And these emotions, this mental health of these mothers and these women, I think that now we are in great debt to them as a country. And to be able to learn and to continue learning and building upon the experiences that we have created here, I think that this is going to strengthen us, and it's going to guide and steer different work plans to continue strengthening this protection for mothers, children, and the society as a whole. Thank you very much. We see that you have a great relationship and there's great harmony. I'm actually gossiping a little bit, but that's great. Okay. So now, can you please tell us, in your opinion, what are the most relevant studies of this results of this study? And do you also want to tell us if you have results? Because as Andrés said, you were going to measure in April and July 2020, you were going to have the last data collection of the intervention. Can you please explain if you have results that you can share about the project in general, and how have you measured them and what are the consequences that you've had? Thank you, Rosario. Well, I would like to highlight three results. The first is the paper that we published in Lancet that we were advertising in this seminar. It's an immediate increase in mental health issues, both maternal as well as the stress within the household due to COVID. And this increase persists over time, even when the lockdown is over and when the families were meeting up again and the economic activity was recovering. But there are interesting results here, which is that in this long-term follow-up, we started to see that the participants in the program who participated in the group sessions of Semillas de Apego, they start to reveal or disclose better capacity to face this new situation, better ability, sorry. So if we look at this increase in the levels of anxiety and persistence, we start to see that there's a difference between the participants and the control group. So for the participants and the group, the pandemic was a very difficult situation. But as time went by, and as Diana said, as things became more stable, those who participated in the program had a better ability, and I think that they start to recover those lessons learned from the program to face these new situations better. That would be the first result. The second result is that the impact assessment shows positive impact in the midterm follow-up. That would mean an 8-month follow-up in the 5 dimensions that are interesting for the program according to the theory of change. So we see an improvement of about 0.14 standard deviations in a maternal mental health index. So 8 months after the program, and even though we are in a situation of conflict where there's displacement, there's homicide, there's poverty and exclusion, we do see that the program was able to improve maternal mental health in a proportion that is statistically significant and that it's of an appropriate magnitude. Then we see that this impact of maternal mental health starts to be mapped out in a better quality and better style in the relationships with mom and dad or the mom and the children, and the style of less negative discipline and more positive discipline, and less stress in the relationships in the household, and the ability of mothers to understand that they have the capability to protect these boys and girls. This means that there's higher maternal self-efficacy. And we also see then that this is shown in positive effects and significant effects in the mental health of boys and girls, effects that are of 0.2 standard deviations. These are large effects and significant effects. So there are less mental health issues in children, and there's also a higher socio-emotional development in children. We do not see effects in cognitive developments or nutrition, for example. The program was not focused there, but we do see a better response in children in the socio-emotional development. So that is the second great result, which means that the program works in a context that is so difficult and so adverse. We were able to implement the program. We were able to implement it hand in hand with the organizations, but also training people in the community. And we were able to create these positive impacts. And the third result is a heterogeneity result, which is important. On the one hand, the program works much better for mothers who had bigger psychosocial problems in the baseline. This means that the program is well designed, and for the people with mental health issues, the program is able to solve those problems. But the other heterogeneity result is what Diana mentioned already. For the families who were much more vulnerable in the socioeconomic aspect, the program is not able to change the situation. And this is connected to the idea of the Maslow pyramid and the hierarchy of the needs. If the family is not stable, they don't have a job, and there's food insecurity, it's very difficult to build a space to work in the emotional world. And I think that this also speaks of the importance of having interventions that are focused on the different restrictions that the families are facing. Those would be the 3 results that I wanted to highlight. And I think that based on this, we are working and we continue to work together. So we are going to start thinking about the scaling of this. That's very good. I have a question. How did you measure mental health? the mental health of mothers, but I'm also interested about the children. How did you measure that? Yes, well, maternal mental health we measured with a series of scales, psychometric scales that are validated, where we asked the mother about a series of symptoms that they could be experimenting, headaches, difficulties in sleeping, and these symptoms in clinical studies are associated with different mental health issues such as anxiety, depression, hostility, and sensitivity, or post-traumatic stress and complex stress. And with the children, what we did is that we have reports from the mothers about the development of their boys and girls, but at the same time, we also have a series of activities where the team of surveyors would sit down with the children and they would play some games, and based on the games you can infer the socio-emotional of the children and their capability of following instructions and so on. So there are observational reports from the children as well as those self-reported by the mothers. Perfect, thank you. There are 3 questions and I think that it's the time to include them, and then we will wrap up the session, which is related to the results. One would be if there's a manual about the intervention, if it's public and it's available, and Michael is leaving his email address if the information is available. The other question, they are saying that the results are great, but if the Colombian government has expressed interest in using these results for their own public policies, and on the other hand, if there's an idea of developing a project not just focused on mothers, but also in the parents, in the father, or including the fathers. That's great. I want to answer the first and the last one, and then I will allow Cristina and Diana, because they know more about this topic of how we can get to the government and how we can make sure that they adapt this. Michael, muchas gracias. Thank you, Michael. The manual is not publicly available, but we are working on that. There are some descriptions that I can share with you about how the theory of change works, so I can send it to you by email. And the question about the fathers is very important and interesting because the program is not targeting women or moms specifically. I have spoken about moms, but this is because 93% of the participants are mothers. We have also a group of grandmothers or aunts, and we've had 3 fathers participating. The program is targeted to caretakers in general, but of course many mothers participated. But of the interventions that we have had in the curriculum, we have also considered how to get to the fathers as well and the raising group as well, because it's not just the mother that plays an important role in the development of children. It's also the group that raises the children, which could involve the father. In Tumaco, for example, the neighbors are very much involved. So how can we strengthen this so that the boys and girls are protected from different perspectives? So now, having said this, in different contexts, and in the case of Tumaco, that was an example, there are some gender roles that are very, very robust. And it's very hard for a father to take that step and to participate in a group of women, right? And that they feel that the father is immersing himself in the role that because of the culture and the community has been assigned to women. And it's interesting because the 3 fathers that participated in the community, they started to bully them. They were saying, hey, why are you sitting there with those women? What are you doing? But we believe that it's important because this is going to create synergies within the household so that we can protect these children even better. Well, just briefly, I want to tell you about the process with the government. They have been informed about this from the beginning. I think that for this to become a public policy or a program financed by the government, at this point, it's very hard mental health in Colombia, unfortunately, is not a priority for investment from the government. I think that with all the evidence that has been generated in these years, we are on the right path of at least collecting the data to continue creating advocacy in public policy and eventually receiving that support. We have had the ICBF at the local level as our partner because they facilitate the interaction with the childhood development centers and the preschool centers. But I think that this is a long path still. We should not give up on the road. And now with the assessment, we as partners, we need to create a public policy advocacy strategy to allow a more active participation. Yes, I agree with Cristina. I think that the challenges are just starting in the path of how to make sure that we can turn it into a public policy. However, we have the experience, a late experience, but it's possible. In the past, we had a similar exercise in an assessment where we participated with Universidad de los Andes and other partners in that allowed us to assess the FAMI program, FAMI Colombia, which is the one that serves breastfeeding mothers at ICBF. And there were some important results. Of all those results, one of them was incorporated and others are underway. And I think that that could be a great example for what Cristina is proposing of some important challenges for the country with the changing government that is coming ahead. And we need to build a work plan that is timely and that also contributes to the creation of the development plan and everything that could be included there in the actions for children. Thank you very much. Just to clarify, ICBF is the Colombian Family Welfare Institute, right? Yes, correct. Sorry about that. Yes, no problem at all. Well, now in 2 minutes left, can you please tell us what you have learned of this collaboration and what are the plans that you have for the future? Who wants to start? Just quickly. Well, since day one, when we created the partnership, I told Universidad de los Andes, I said my interest as a foundation is to get to the most vulnerable population and to have an initiative that we can replicate and escalate. Right now, we are in an initiative that is also new, also full of lessons learned, which is the methodological transfer so that it's not us who operate, but a different organization. So we are validating different paths to make sure that this can reach more families and more children. Diana, do you want to say something? Yes, our lesson learned, I think, is to continue strengthening these types of partnerships. Semillas de apego is the future of other topics that we can work on to create advocacy in the mental health of children, and that it's possible to have different perspectives, but if we pursue the same cause, we can work together. Andres, I agree with Cristina and Diana. On the one hand, the need for this not to just stay as an article, but that we use it for the positive aspects. There are many lessons learned and to try to create advocacy in public policy, but also how we can transfer this to other operators so that they can escalate the program to other areas in the country and in the region. And also, as Diana mentioned, we want to acknowledge the role and the value of these partnerships. We wouldn't have been able to do this by ourselves. And these joint efforts that have taught us many things, hopefully it can continue so that our research that we conduct and the projects that take place from the foundations can create more value and more impact. Thank you very much to you all and to our panelists and also to the participants in this presentation and in this discussion. These were fascinating results. Thank you very much for your questions and the comments. And I think that this is a great example of how we can develop relationships between the academia and foundations and organizations so that we can obtain wonderful results that can create a true impact in public policy. Thank you very much for your participation. And if you want to obtain more information about EGAP, please click on the link that we can see in the chat. Thank you very much. Thank you.